Hi, good morning. My name is Dr. Jafri. I'm a pain specialist and an anesthesiologist at Genesis Pain Clinic. Welcome to our clinic. We primarily do interventional pain, medication management, physical therapy for patients who suffer from chronic pain. I have a patient with us. His name is JF, visiting, and I'd just like to talk to him about his pain and how we've been able to help him with his pain. Josh initially came to us several months ago complaining of low back pain that radiated into both of his legs and into his spine that started after an accident. He had seen various providers and had limited success. Upon review of his imaging, we noticed a few things which included degenerative disc disease and foraminal stenosis and a torn disc. I'll just let Josh talk about his symptoms before he came to us.
Yeah, so it was various, and it was very hard to target what was going on because I would have random leg pains and no rhyme or reason to it. And I knew that the low back pain that I was experiencing sometimes was so intense that I couldn't do anything. In fact, I was off work for about 6 months just trying to figure out a way to be mobile and get around. And so I was with a cane for a while. I think once the swelling went down a little bit from my car accident, I started being able to at least function mobily, but the pain was still constant and intense. And sometimes it was, bedridden, 8, 10 pain, so.
Right. Before you came to us, what are the things you tried?
So I had physical therapy. I had the shots that they do on my back, and I had a few consults about talking about, hey, probably the only way that you're going to get rid of this pain, or even there's a chance of not getting rid of the pain, was to do a fusion surgery on both my L4 to L5 and my L5 to S1. And I'm in my 30s, so having a fusion surgery in my 30s just doesn't seem appealing to me at all.
Right,
so,
right. And then, you obviously were not happy. You weren't making progress. How is it affecting your life as a professional or your family life? Or...
So, many different things. Personal life kind of got uprooted quite a bit. I wasn't able to be as active as I used to be. I used to weigh 400 pounds, and I had lost all the way down to about 220 pounds. And after the car accident, I put back on, 60 to 70 pounds because I couldn't do as much. Then my professional life, again, I was off work. I wasn't able to work for about 6 months. And that was super challenging because I'm a band teacher. I teach music, and it's my passion. And so the inability to do my passion has been was very detrimental to my mental health. And so a combination of all that and not being able to do what I love to do really just put me in a bad place.
Okay. So when Josh came to us, like many patients who've had chronic back pain, the pain can be so severe at times that they cannot function. They have a hard time with their personal life, professional life, and many of them end up gaining weight because of the immobility. And what Josh is suffering from, if you look at the spine model, he has degenerative disc disease at multiple levels, and one of his discs is leaking. So in many ways, it causes him to herniate the disc, which can cause the nerve root to be compressed and have the pain radiate down into his legs. In addition, he will have significant stiffness in the morning, and after prolonged standing and walking, pain going down into his legs. This is a medical condition that requires both medication management, interventional procedures, and once the pain is under better control, regular exercise, stretching, and weight loss. So it's a multi-pronged approach to treatment that has to be done, and patients have to have realistic expectations how much better they'll get once they have better pain relief. So when Josh came to us, we kind of explained, set the realistic expectations, and started a treatment plan. Since he'd already had an epidural in the past, Can you tell us how much the epidural at the outside clinic helped?
It didn't help at all. Like, I had zero. In fact, it was to the point where the doctor that gave it to me basically did half of it and just said, no, we're not going to do anymore because it's not going to be effective.
So at that point, we decided to target these facet injections, which are the other two joints that exist in your back, and basically doing a diagnostic injection to see if it helps. So we place a needle and we disconnect the nerves here. We have the patient take a pain diary, and on subsequent visit, if it helps, we repeat it again. And when it's successful, then we can take a tiny needle and place the needle, which does a radio frequency ablation, disconnects the nerve that goes to this joint. Once we disconnect the nerve, the patient does not feel the pain from these joints for up to 2 years.